My name is Helen Ryan, and I am actually a District of Columbia-based social worker, though I do spend a lot of time in Baltimore. And I want to talk to you tonight about something called invisible homelessness and the role that reproductive care can serve in alleviating it. And I do want to let you know that there is a little bit of an interactive component right at the beginning, so just stay awake for at least the first couple minutes so you can get through that portion. Then you can take a nap if you want to. So let's get started. So this is the interactive component. First of all, I want to ask you, who are your homeless? Now, don't shout out answers to me, but close your eyes, if you will, and just run a Google Images search in your mind for what homelessness looks like to you. Do you see young people or old people? Do you see men, women? And now I want you to raise your hand. Oh my God! I told you. No, I want you to raise your hand if what you pictured are families. Now, if you don't really picture families, that's probably because they're part of what is known as the invisible homeless. We often think of the homeless as those we see sleeping on the street, when really it's anybody who doesn't have permanent housing. So in Baltimore specifically, 44% of the sheltered homeless are in fact families, and 86% of those are headed by single moms. So the services that are really helpful to those families and that can really help them get out of homelessness are not necessarily the ones you typically think of in terms of soup kitchens or work programs or something that fits with your stereotypical image of male single homelessness. Now, targeted reproductive health care is paramount in helping homeless families progress out of homelessness, because pregnancy really keeps homeless families there in that situation and pushes at-risk families into homelessness. Double the rate of homeless women are pregnant as compared to their housed counterparts, and 3 out of 4 of those pregnancies are in fact unintended, as opposed to 1 out of 2 in the general population. So it's really a big problem for homeless families. And in fact, most of these families really don't want to have more children. However, one study showed that 42% of these families don't know how to use contraception at all. They just don't know what they would do with it. And 37% didn't know where they would find it. So there's the intention, and then there's the actual action. And some of you may or may not recognize this as a screenshot from a video clip that went around earlier this year, kind of riffing off how difficult it is to get birth control, even for just a person who's housed, who has a job. They just have to go through all these hoops to get their monthly pills or whatever it might be. And if you're homeless, you're really not thinking about that as one of your priorities. You're concerned about being sheltered, and as a result, reproductive care really kind of falls by the wayside. For those who are homeless, they're also really not able to use storage in the same ways that a lot of people commonly think of in terms of having condoms in a nightstand or having a private bathroom where you can keep your supplies or what have you. These are people that are in shelter or living out of their car, and this really impacts the choices that they have to make about birth control. Also, access for getting to the doctor, getting to the pharmacy, transportation, childcare, all of these things are huge barriers for the homeless in terms of getting to reproductive care, and can mean the difference of 1 visit versus 2, having birth control or not having it. And also, for those who are homeless, the power dynamics are really different when it comes to sex. They may be trading sex in terms of getting a roof over their head, or staying with a boyfriend that they'd really like to leave, and they may not be able to negotiate contraceptive use in a way that they'd like. And also, homeless people do experience rape in much higher numbers, unfortunately. Now, if you're able to invest in making contraceptive care easier for the homeless to access, it will really reap rewards that go beyond just changing birth rates and changing unintended pregnancy rates, but you will really give back to the community and empower families to progress out of homelessness. So for providers who are working with the homeless, they really need to make reproductive care paramount in the case plans that they are developing with their clients, and make it easy for the clients to access. Really broad education around reproductive care needs to be given in terms of PSAs, and not necessarily sex ed in schools, given that homeless individuals often don't complete high school, so it just needs to be a really wide message that can reach the homeless. And also, the health care that is being given to the homeless needs to be nuanced to their needs, not just treating homelessness like a problem that you throw condoms at because they're cheap and easy to get, but considering all of these factors and whether IUDs might be more useful or long-term implants, and really having a conversation around the actual realities of the homeless individual. And just improve the access through mobile clinics, through having in doctor's office pharmacies, so that people are able to get the care that they'd like instantly and not have to go through all of those hoops and really delay the process. Now, $4.26 versus $1, that is the return on investment that the Brookings Institute found for a Medicaid study in terms of a hospital birth cost versus proactive care. And obviously, some of these outcomes are a little bit self-evident from what we've been talking about. But I've just been talking at you for 5 minutes, so what are you supposed to do? Well, you should be informed, hopefully, and be able to see the invisible homeless a little bit better now. Vote through your dollars, vote through your civic action, and yes, it's corny, but talk to your doctor. And you can maybe even, if you're a doctor yourself, I know Johns Hopkins is right across the street, essentially, consider about your care that you're giving to clients if they are homeless, or just if you are providing reproductive services. Keep that in mind, that homelessness is a concern for a lot of people. So hopefully you're empowered now to see and end invisible homelessness, and thank you for your time.